So today Kate and I presented on the Australian Breastfeeding Association Bushfire Project, and in our presentation today we really focused initially on some of the research that we've undertaken to give us a good evidence base for improving planning and support for families in disasters. So specifically, our research focused on interviewing and surveying parents and emergency responders who supported children aged 0 to 4 years of age during the Black Summer bushfires. And we looked at, this was an Australian first research project, by the way, that was looking at emergency evacuation, preparedness, response and recovery, specifically for families with young children. So the findings of that research were then used to guide the next part of our project, which was developing resources and implementing that within a specific location, which is the Eurobodalla Shire, where both Kate and I are from. So that was kind of the summary of our project today, really looking at how we engage with the community to implement the findings of our research.
To be honest, it wasn't anything we weren't expecting to find. We just needed to establish that evidence base. So families struggled. Often mothers were evacuating by themselves without the support of a partner. The partner was staying to defend, and they would have one or multiple children with them, possibly even a grandparent that they needed to look after as well. So those findings showed us that often women would not look after themselves and be trying to look after, say, a toddler and a newborn, and that was exceptionally challenging for them. So they put their own health and potentially their baby's health at risk by being dehydrated, not getting enough food. Our study showed that they struggled to keep their own children safe and often didn't know what to expect when they reached an evacuation centre. So they were rocking up expecting to have access to clean water, and they didn't, or they expected to have electricity available and they didn't. So part of the resources that we've created are evacuation kit lists for various feeding methods and age groups, and that tells them what to pack for 3 days without those resources.
So yeah, we've got about 6 months left in our project, and we're really looking to consolidate some of our resources, and those resources are very wide in their breadth and depth. So for example, we've partnered with a number of different organisations to create resources. We have partnered with Safe Sleep to create sleeping resources for infants in evacuation centres, with the Australian College of Midwifery to create a birthing and emergencies kit, information and kit.
There's also resources for emergency responders as well. So we have a 15 to 20 minute e-module available free online as well. And that just helps emergency responders identify the potential issues that parents with young children could be facing, and just gives them the tools to potentially be able to help and see those risks earlier and help deal with them.